Good day, class. In this video, we are going to talk about the next paired syndrome, the cold and heat. The cold and heat syndromes. From their name, you may understand the nature of these two syndromes directly. We always talk about yin and yang in our theory. However, we cannot see yin and yang. But how we know yin and yang? That's from the cold or heat. So we cannot see yin and yang, but we can see the cold or heat. So the cold and heat syndromes may reflect the yin and yang condition in the body. The cold syndrome refers to a patient suffer from either cold pathogen, the cold exogenous pathogen, or the weakness of the healthy qi or the antipathogenic qi, especially the yang qi. So when you see the cold syndrome, you need to reflect in your mind that is it from the pathogen or from the antipathogenic qi? These two aspects. One is the pathogen, one is your healthy qi. The pathogen, they got different natures. We got yang pathogen, we got yin pathogens. Yang pathogen, such as the fire, the summer heat. Summer heat is quite confusing or very tricky because we got yang summer heat and yin summer heat. And the other example is the dryness. That's a yang pathogen. We also have yin pathogens. For instance, the coldness, dampness. So these are yin pathogens. A patient suffer from yin pathogens, such as the patient suffer from dampness or the coldness. The patient will present with a cold syndrome. So a cold syndrome, the patient will have the feeling as coldness. So the characteristics of a cold syndrome is the feeling or the temperature, the coldness. The manifestations include chills, cold intolerance, preference for warmth, cold pain, tasteless, absence of thirst. The reason for absence of thirst is because the cold syndrome is a yin condition, so the yin condition will not consume the body fluids. The cold lumps, everything's cold intolerance. The nasal mucus, saliva, phlegm, all will be thick, thin, and clear, and also can be perfumes. The perfumes, urine, also can be perfumes, nasal mucus. So these are all the manifestations of a cold syndrome. The tongue is pale, that's also due to coldness, and be the yang deficiency. Moist, because we still have the fluids in the body. White, slippery coating. The slippery coating also can indicate that's excessive body fluids, and this body fluids is the fluids that we don't need. The pulse is tense or slow. The reason for tense pulse is because of the contraction. The contraction from the coldness. The slow is due to the yang deficiency. So the coldness slows down everything. This is very similar if you put something in the freezer. With everything slowed down. The water, if you put in the freezer, the water will never move. and then become an ice cube. That's something slowed down. So a cold syndrome. The key manifestations can be the cold intolerance, and the patient feel better in a warm condition, a pale complexion. The possible causes of a cold syndrome can be the cold pathogen. For instance, in summer or either in summer or winter, in summer in the evening, in Joburg, still a little bit cool. So there's one day you got a party with your friends and then you jump in the pool. And then the second day you got fever. So in this situation, you got a cold syndrome or a cold pathogen due to suffer from the cold environment. This also can happen in winter. So a cold syndrome may happen in winter while the temperature from the climate is cold, or even in summers. In summer, if you suffer from this kinds of environments, one is the example I gave you just now, you jump in the pool. The other more common situation is someone in their environment. For instance, someone they work in the supermarket, in the food, in the meat area. So they always with the freezer or the fridge in the cool room. So this kind of job will affect their health as well, because the fridge and freezer is also considered as the cold pathogen. Then another cause also can be the food. So if a patient eats excessive cold food, ice cold stuff, ice cold water, ice cold juice or milk, or salad, the raw salad. So these are the possible, this might be the possible causes of a cold syndrome. The cold syndrome can be divided into excessive cold syndrome or deficiency cold syndrome. Excessive cold syndrome is due to the excessive pathogenic qi or excessive pathogens. Deficiency cold syndrome is due to the yang deficiency of the body and results in the internal coldness. So these two, the patient will present differently. The excessive cold syndrome, the patient, the pulse may present as tense. Deficiency, the pulse may present with slow. The cold syndrome also can present as exterior cold syndrome and interior cold syndrome. So these two are quite similar. The excessive cold syndrome and exterior cold syndrome. You just see the cold syndrome from different way. You're going to see from the excess and deficient, or from the exterior or interior view. So the same cold syndrome you can identify in these two different syndromes. The cold pathogen is a kind of in pathogen. So the in pathogen is very easy to consume yang qi. So the patient will present even from the exogenous pathogen. The patient also may present with yang deficiency because the in pathogen is very easy or is very likely to affect the yang qi in the body, and these will result in yang deficiency. So the patient will present with the manifestations of yang deficiency. That's why from the signs and symptoms, you will see many symptoms with coldness. That's very typical for yang deficiency. And curled up lying position. That's also due to yang deficiency. The coldness will not consume the water and the fluid, so the patient will not feel thirsty, and then also the clear perfumes of urine and phlegm or nasal mucus. Loose stool, even diarrhea. Diarrhea, especially diarrhea in the morning, and then in future when we study the Zangfu differentiation, we will know that diarrhea may due to the kidney yang deficiency. So these are the possible manifestations. A heat syndrome. A heat syndrome manifests as hyperfunction of the body due to contraction of external heat, yang, hyperactive due to yin deficiency. So most importantly is the yin deficiency and the external heat, similar to the cold syndrome. It's not only the heat, the external cold also can cause a heat syndrome. This will depend on the body constitution. Yin deficiency. If the patient have less yin, which means he has relatively excess yang, the excess yang will cause heat. That's deficiency heat. So from a heat syndrome, also most importantly is not the definition. You can add the other causes from the definition, but most important is the signs. A kind of hot signs or hot symptoms such as fever. Prefer for cold. They want to drink cold water. Avoid to heat. They don't like heat. They feel thirsty because the heat, the characteristic of heat, can consume the body fluid. If you don't remember these, you can go back to the basic theory. As you can see, while we studying the theories, the diagnostics, and then in future we study the therapeutics, we always repeat the similar theory. So if you don't remember, go back to the basic theory. What's the characteristics of the pathogen heat, exogenous pathogen heat, or internal heat, internal evils? What's the characteristics? That's how you can explain the thirsty. And this thirsty with a desire to drink. That's because the body lack of body fluid, thick yellow nasal mucus. Yellow mucus is heat. It can be heat. It also can be thin. What's the difference? Thin. Oh, sorry, not here. It's from the tongue. The tongue can be thin. So as you can see here, the tongue we mentioned the yellow coating. The tongue can be thin yellow, also can be thick yellow. The coating can be thin and can be thick. What's the difference in a thin yellow coating and a thick yellow coating? The difference is the interiors or exteriors. So that's the stuff we have mentioned in the previous video. You can go back to there, though you combine with exterior heat syndrome or interior heat syndrome. That can present as thin yellow coating or thick yellow coating. Here, the patient will present with thick yellow nasal mucus. Why thick? Yellow is because of heat, but why thick? It can be you can use the word thick or sticky. The reason is because the heat will consume the body fluid. So it is kind of concentrate the mucus. That's why it becomes thick and sticky. So that's also another sign of the heat. Restlessness, red face. Why is it restlessness? Because they don't have enough in fluid. So the excess yang, dark yellow urine. That's also yellow. The color. When we talk about the facial complexion, the color. When we talk about the tongue inspection, the color, yellow, always indicates the heat. Or constipation, because the heat will consume the body fluids. That's why there's no fluids in the stool, then will result in constipation. The tongue is red with a dry yellow coating. The pulse is rapid. So as you can see here, when we study the differentiation, we always combine with different manifestations, different symptoms from different diagnostic methods. As you can see from here, you got something from the inquiry, from inspection, from the tongue inspection, from the pulse diagnosis. So most you need to remember a heat syndrome with a sign or with the symptoms of heat or hot. So that's the difference between heat and cold. Cold syndrome, because the cold pathogen will not consume the body fluids, so it's without thirsty heat, because the heat or the fire will consume the body fluid, so thirsty with a desire for cold water. Complexion and the tongue, white or pale, red, are similar. The pulse, slow or tense, rapid. So that's the differences between a heat and a cold syndrome. Sometimes we want to understand the cold or heat condition in a patient, and as I said before, the yin and yang we cannot see, but the cold and heat we can see. So sometimes I will ask the patient, if there are two glasses of water, one is a cold water, one is a hot water, which water do you prefer? If the patient says, if the patient says that I prefer drinking cold water all the time, then you can assume that the patient has excess heat in the body. If the patient tells you that they prefer warm water or hot water, they can't stand the cold water, then you can assume that the patient got the internal coldness. The internal coldness can be from the exogenous cold or can be yang deficiency. So that's the inquiry tip in the clinics. Also, the heat can be a result from yin deficiency. For yin deficiency, you will have a relatively excess yang that will result in heat. Apart from these manifestations that we have mentioned in the table, especially for the heat syndrome, there can be many more manifestations. It depends on in which situation. So you can just imagine sometimes how to remember these manifestations. There are just so many manifestations, so many symptoms. So you can just think about a rapid pulse for heat syndrome. We have mentioned that in the pulse diagnosis, a rapid pulse is due to the heat, because the heat will activate, will speed up the circulation, the blood circulation. That's why the patient will present with a rapid pulse. So now you know that the heat will increase the circulation, you promote the circulation, and then you have rapid pulse. And then in the other situation, you can think about the blood is not only present in the pulse. If the blood runs too fast, runs out of the vessels, it becomes bleeding. So such as nose bleeding, we also can think about the heat. Or for ladies, their period comes earlier, early menstruation. They're supposed to come once a month, but now there's one lady, the period comes in every 2 weeks. The early menstruation also can be the excess too active blood circulation. That can be a result of the heat. So there are many different manifestations. The more you think about, the more there will be, and it also will be more interesting. Also from a rapid pulse from the heat. The heat can be deficient heat. It also can be excessive heat. How do you know from the pulse? That's from the feeling. A weak pulse, excessive pulse, or deficient pulse that we have introduced in the pulse diagnosis. From the causes of a heat syndrome, we have mentioned that the congestion of external or the exogenous pathogens. It can be cold, it also can be heat. The body constitution. Is there any other factors that can result in a heat? Is there any factors that you can think about that can result in heat? Such as the improper diet that we have mentioned in the basic theory. There's one boy, he enjoys eating KFC every day, every meals. He enjoys the deep fried food, greasy, deep fried food, and he enjoys eating a lot of meat. This improper diet from the food also can result in a heat syndrome. So this patient may present nose bleeding or constipation. Also, that's from the diet. From the medicine, if someone took too much herbal medicine with hot property, this also can result in heat. Or from our acupuncture and moxibustion. If we apply moxibustion, in future you will know what moxibustion is. We burning a kind of herbs on top of the skin that can increase the heat in the body that's suitable for cold condition. But if you apply too much, it also can result in heat. So that's two other causes from food, from improper diet, from the medicine or treatments also can result in heat. The next one, is there any more causes of the heat syndrome? The stagnation, such as the qi stagnation, or the emotion due to the emotion. This is very similar if you put a lot of grasses in a corner of your garden. You leave there, the grasses, the waste, you leave there for a long time. And after a long time, in the grass, it becomes warmer. So in this situation, we call that the stagnation. If the qi in the body didn't move, it stop in one area, it stop in one meridian, and then it stayed for too long, we call qi stagnation. And then the qi stagnation, similar to here, will result internal heat. That's also a kind of heat syndrome. That's how the emotion can result in a heat syndrome. That's also why if someone depressed or someone angry, they will be irritated. Irritated. That's also a sign of a heat syndrome. So these are different causes of the heat. When you compare with the heat and cold, you compare with the temperature, the body fluid, the color, such as the color from the complexion from the tongue. The body fluid can be the mucus, yellow or pale or white. And also you're going to identify from the pulse. These are the information on the cold and heat. As we study more, you can just try to think about different manifestations around you and then try to analyze in this way. Thank you for your attention.